Hi, my name is Dr. C. Nice to meet you.
Nice to meet you too.
Today I'm going to be doing a musculoskeletal exam. It's also going to include a couple of DNA samples, one to check your metabolism as well as your hormone levels, and the other to check for any genetic musculoskeletal disorders. Okay?
Okay.
Can I confirm first your name and date of birth, please?
Yes. Madpasmr. It would be June 2nd, 1989.
Perfect. Okay, let me go ahead and put some hand sanitizer on first, and then I'm going to do my gloves. Any pain that I need to be aware of in any of your muscle areas? Any neck pain, back pain?
Yeah, actually I do have some shoulder pain right here on my shoulder blade. I feel like it's underneath. I don't know, it's like a knot or something.
Okay, I'll check it.
And also some pain in the back between the shoulder blades.
Okay, I'll have a look. I'm just going to put my gloves on. I'm going to be a little bit close to you if that's okay.
Yeah.
I'm going to start first with your vital signs.
Okay.
I'm going to do I'll just take a finger.
Okay.
Here we go. And you can put your hand on it. Just relax. Okay. Are you nervous?
No.
No. Good. You have a good heart rate and good pulse ox.
Thank you.
And then next we're going to do your blood pressure. If I can just have your right arm. And if you can just put your arm out for me. Please let me know if it's too tight. This way. And actually, let me keep your arm here for me. And then actually, would you be able to hold this part for me here?
Yes, of course.
One 10/60, very good. Okay. And next, I'm just going to listen to your heart and lungs, and you can just breathe comfortably, and I will let you know when I need you to take a deep breath for me, okay?
Okay.
All right. Sounds good. And take a deep breath and exhale. Good. A deep breath and exhale. Good. Deep breath. Good. And now you can just breathe normally. Good. And then while I am back here, I'm actually going to take our first sample. It's just going to be a hair sample. I'm not going to pull at your hair at all. I'm just going to go through with this comb, and I'm going to look for any little stray hairs. And then while I'm at it, I'll also do a brief cranial palpation, just to make sure no lumps, bumps, masses, anything like that. Okay? Little loose hairs here. everything feels good. No masses, no bumps. No pain?
No pain.
Okay, good. Okay. Can you see? Okay. And then just gonna open that. I might need a little help getting this in there. Like this. Okay, we have our first sample. Good. I'll do a brief exam on your neck. First, I'm just going to palpate. Please let me know if there's any significant tenderness. And I'm going to check if there's any pain with range of motion. So can you please turn your head for me? Any pain?
No.
And then left. Any pain?
No.
And then down, please. Okay. And then okay. That's good. Relax. Okay, everything looks good with your neck. And then we're gonna check your shoulders. Same thing. I'm gonna palpate. Do you feel any pain where I'm touching?
Just a little bit in the back here.
Right here?
Yeah.
Over your scapula?
Yeah.
The good news is I think it's soft tissue. I don't think there's any sprains or strain. It might just be you need a massage. And then go ahead and shrug your shoulders for me. And then relax. Okay, that's symmetrical. And then I'm going to move your arm to check your range of motion. And if you feel any pain, please let me know. So we're going to straighten this arm out. Any pain?
No.
And then I'm just going to bend your elbow here. And we're going to go back here. Behind your back. Any pain?
No.
Okay, good. I'm going to do the same thing with this arm. You can put it a little bit more in front. Here. Raise your arm. Does that hurt?
A little bit.
Okay. And then we're going to put the arm down. And then I'm just going to reach it back behind. Does that hurt?
No.
And then I might prescribe some exercises for the left shoulder just to kind of help loosen things up a little bit.
Mm-hmm.
And then while I'm back here, I'm going to go ahead and check your thoracic spine and then your lumbar area. Okay. And then same. Any tenderness to the paraspinal muscles here?
No.
I don't feel any muscle spasms, which is good. No lumps, no bumps, no tightness here.
Mm-hmm.
And then can you do me a favor and just twist? Any pain?
No.
And then twist. Any pain?
No.
And then do me a favor and lean forward just a little bit to check your flexion and extension, okay? And then you can come back to me and then back. Not too much, just where it's comfortable. Okay, good. Any pain with any of those movements?
No.
I'm gonna just palpate the sacral area, and then I'll check the sacroiliac joints as well on the side here, as well as your hips. Is it okay if I lower this just a little bit?
Yeah.
Okay, I'm just gonna palpate. Any pain?
No.
Okay, good. I'm gonna come forward now. Okay, very good. Now I am going to actually do a brief neurological exam. I'm just going to check your pupils. I'm going to palpate some around your jawline and your face. I'm going to check asymmetry, and I'm also going to check for any deficiencies with sensation. So I will let you know. And then for now, let's look at your eyes first. So we're going to check your eyes first, and you can actually look just over here a little bit. I'm going to check your pupil reaction. Okay. Good. Pupils are equal and reactive. Very, very good. And if you can please just follow my finger. Don't move your head, just your eyes. Very good. I'm going to need you to close your eyes now. And I want you to tell me if you feel anything on your left or your right.
Left. Right. Forehead. Chin.
Very good. Very good. You can keep your eyes closed. I'm just gonna palpate around your jaw here. Can you open just a little bit for me? And then close. And then same as before, I'm gonna check your sensation, but this time with my gloved hand. And you let me know if you feel something either more on the left, on the right, or if it's more equal.
Right. Both. Left. Left.
Very good. Okay, and then you can look at me, raise your eyebrows, and relax, smile, relax, puff your cheeks, stick your tongue out, open your mouth. Okay, good. Relax. And while I'm up here, I might as well do a brief oral exam. Can you please open your mouth again? And say ah.
Ah.
Very good, very good. So for this portion of the exam, I'm going to be checking for your hips, mobility, any crepitus. I'm going to check the strength and the range of motion. So I think it would be best if we had you laying down.
Okay.
So now I'm going to be checking your hips. First, I'm going to just palpate for any tenderness. So please let me know if you feel any pain. And then while I'm here, I'm just going to check some measurements briefly just to make sure that everything is symmetrical, that one side is not shorter than the other. Okay?
Okay.
And you can just relax. Okay, good. So now I'm just gonna be looking at your hips, range of motion, and please let me know if there's any pain with movement, okay?
Okay.
And you can just relax. I'll move your leg for you. Any pain?
No.
And then we're going to do it again, but this time I'm going to be palpating your hip joint for any crepitus, any creaking. Okay. Lift up. And down. And we're going to lift back up. To the side. And down. So I'm going to do another test called the straight leg raise, which is basically what it sounds like. I'm going to raise your leg up, and please let me know if you feel any pain to your lower back. this helps me to determine if there's any nerve issues or any potentially slip disc that I need to know about. So please flex your feet for me. And then I'm going to straighten your leg. Any pain?
No.
Okay, good. Any pain to the low back?
No.
Very good. And now I'm going to actually check your knees from a laying down position. I'm going to check your reflexes. I am also going to check for any pain to the knee joint, any pain as well to the patella, to let me know if there's any issues with the meniscus or with any of the tendons or ligaments. Okay?
Thank you.
So first we're just going to have you bend this knee, and I'm just going to let it dingle, and you can just relax. And please let me know if there's anything painful.
Okay.
Okay, very good. Any pain?
No.
Bend for me one more time. Any pain?
No.
Okay, it looks like the flexion, extension is normal. And then same with this. Can I just kind of let it dingle? Checking for your reflexes. There you are. Any pain?
No.
And I'm going to check your ankles next, just to make sure that there's no issues with the Achilles tendon, no recent sprain or strain to the ankle while walking. No, have you ever had any twisting injuries to your ankle?
Long time ago.
Okay.
When I was little.
Well, I'll check for any weakness or any issues with the range of motion.
Okay.
And I'm just going to raise this a little bit.
Mm-hmm.
I'm just going to palpate. Please let me know if there's any pain. I'm just going to do a quick measurement, just make sure that it's equal, no inflammation. Sometimes it's a little bit hard to tell just looking at it, so just want to make sure. Okay, looks good. I'm going to just check your motion. Is there any pain?
No.
This way. And I'm just going to flex and extend the feet. Please let me know if there's any discomfort. Okay, and now I want to check your strength. I would like for you to push against my hand. Very good. And now please extend your foot against my hand. Very good. No crepitus. Very smooth motion. Now please push against my foot. Very good. Extend your foot. Very good. Let me check your pulses while I'm here. Two plus. Very good. Other side. Very good. So now for the last two parts of the exam, I'm going to take a few measurements of your body mass, different areas, just to check your percentages. From what I can see, everything looks good. and normal. But as you know, everybody's body composition is different. So I just want to double check, take some measurements if that's okay with you.
Yes.
And the last part of the exam, I'll take a DNA mouth sample. And I like to do that at the end because it could make your mouth a little dry so that you can have a drink after. Okay?
Thank you.
You can just relax. Okay, 4.5. Very good. And if you don't mind, I am going to take a measurement right here in the upper part of your abdomen.
Mm-hmm.
And you can just relax. Okay. Well. So now I'm going to get a mouth sample. Okay, this is brand new. I'm actually going to get 2 samples, one from each side of your cheek. Okay. Just loosen this up a little bit first. Okay. And if you can please open your mouth for me a little bit. Thank you. Okay. Swirl it in the solution there. And then open your mouth again, please. Very good. Okay. You can sit up. We're all done. Not too fast. I don't want to make you dizzy. You are all done. You did great. I'm going to send your samples off to the lab and I'll let you know if anything abnormal came back, as well as I'm going to prescribe you some exercises to do at home for your shoulder. Again, I didn't see anything concerning for rotator cuff tear or any sprain strain. I do think is musculoskeletal. And that's basically it. Do you have any questions for me?
No, thank you so much, Dr.
Thank
C.
you. Thank you. Okay.